Well, when I was in medical school at Columbia University, because of a very large donor at a time that I'm not familiar with, they had a rule they had to have 10% women, which was more than almost any other medical school in the country. And now, more than half the medical students are women. So it's a totally different world. Initially, as the women came on, and this has been going on for many years now, very few of them went into urology because it was thought it was a field for men. And there were some social pressures not to do that. But now the percent of young urologists who are female has increased dramatically from probably 2 or 3% back in my day, or maybe even less, to about 30%. It's still a minority, and it's a field that still has more men than women, but there are significant numbers of women in urology. And I think this is a very positive change. The women with urologic problems mostly prefer to be taken care of by a woman. And the women who go into medicine, in general, are more caring than the men and have less of a problem with their egos. That's not always true, but it's usually true. So I think let me back up. Our residency was one of the first to, at the University of Virginia, was one of the first to have a significant percent of the residents as women. And I found them to be excellent. And in fact, often, not always by any means, but often better than the men. So I think it's a very positive change that for both for the patients and for the field that women are much more involved.